forgot to record. Now it's recording. Our next session would be May 5th, if I'm not mistaken. And that's going to go, the same way we've been doing it through Zoom for now. And then after that, and when we come back on May 5th, we're going to try to see what's the plan for the next one, see if we can get together already for the last session. And if not, we'll see what's the alternative. But yeah, we just wanted to put that out for now. It's basically taking things day by day. So there's not a whole lot that we can say right now. So we'll just wait a couple more weeks to figure things out. Okay. All right. So I'm going to ask Steph to put the camera on if she's okay. Just to introduce her. Again, some of you might have seen her a month ago, I think. I was going to say a couple of weeks, but no, there's the one. So you might have seen it a month before. So Steph, again, is one of our facilitators here in Unlisted, dietitian. So I'll let her introduce herself a little bit better. And today's topic is art health, which includes many different things. Probably a few things that you already talked along the program. Some things might be new. And like I said earlier, there will be some poll questions. So I'm going to put them up. They're going to show up in your screen. So for those using the computer or using an iPad or whatever it is, it's going to show up. You can click answer, and then we'll see your answers and kind of see the results. For those who are on the phone, I'll try to read them out loud to you, so then you can also hear them and then try to answer in your head, and then we'll tell the answers later, and you can see if you're right. And I think that's it. So I'm going to pass on to Steph. I'm going to mute myself, pass on to Steph, and if you have any questions, we missed session 20. Oh, I think there was so we switched. Yeah, exactly. So this is 21, and the next one will be 20. So we just had to change. Initially, our next facilitator for the next session will be Courtney, and she was supposed to not be here. Her trip was canceled in the meanwhile, but we decided to just keep things as they are right now. So yeah, so session 20 is next week. Today is session 21. So just switch the sessions. Right, so if you have any questions, write it on the chat box. If not, then we'll continue. And then at the end of the session, I'll try to again unmute everybody so everybody can talk, right? Okay, so I'm gonna pass it on to Steph.
Hi, everyone. Can everyone hear me? I'll wait to see. Can everyone hear? Okay, there we go. I clearly don't trust this technology as much as I should. I just wanted to make sure I was doing it right. So hi, everyone. It's Stephanie here. For those of you who don't know me, I guess anyone attending from Kirkland Lake who may not have attended last time, I'm Stephanie Boyle. I'm one of the registered dietitians in the area and certified diabetes educators. So I work at 3 of the local family health teams. And I'm here today to discuss heart health, which is a very important topic for us to discuss, and hopefully something that people have been waiting to hear a little bit more about. We talked about it very briefly early on in the program, but today hopefully we'll give you a lot more detail and answer any questions that you might have. And as Laura mentioned, we're going to try our best to make today's session a little bit more interactive than the one I offered about a month ago. And we do have some polling questions prepared to just try and involve everyone and do sort of almost a little bit of a quiz. So as I mentioned, today's session is heart health. Unfortunately, heart disease is the leading cause of death in the world for both men and women all over the world. So as I mentioned, sort of quite an important topic for us to try and discuss and to try and prevent and promote heart health. So I'm actually going to start off right away with some quiz questions to see how heart smart you are. And then we'll sort of reconvene right after that and see how things go.
Right, so it should be showing up in your screen now, so you can start answering the questions. I'm gonna read them. Yeah. I just want to make sure, can everybody see the questions? For those who have an iPad, a computer, can everybody see the questions in the screen? I see one person already answered, so can you please let me know in the chat box if you can see the questions? Okay, yes, all right, okay. So I'll just wait for you to answer them. And in the meanwhile, oh, yeah, would you like to read them? And yeah, okay, so Stephanie is going to read the questions as well.
Yeah, so as I mentioned, this is sort of a quiz about how heart smart we are. So number one question, how big is your heart? Is it the size of your eye, your fist, your head, or your foot? Number two, how many times does an average human heart beat per minute? 20, 50, 70, or 120? Number three, if a person doesn't exercise and they are out of shape, do you think his or her heart would beat faster or slower than 70 beats per minute? And as a person exercises and becomes more fit, does the heart beat faster or slower? So those two questions sort of go together. And number five, when does the heart rest? A, when you are sleeping. B, when you are sedentary, like watching TV. C, between beats. Or D, it never rests and it's always working.
Okay, so we had 10 of 14 people answering, so I'm just going to give you a couple more minutes. Maybe not everyone would be able to answer, even if you're in the computer. Just sometimes there's some glitches, so I apologize for that. But I hope you register the answers in your mind, and again, those on the phone as well. So I'm just going to give you a few more seconds. Yeah. Sorry, Monica, that you're unable to answer. Write the answers down. We'll quiz you on that too. Okay, so it's been 3 minutes. So what I'm gonna do is I'm gonna end the poll. Oh, and another person answered. Wonderful. To 12 or 14. Okay, so I'm gonna end the polling, and what I'm gonna do now is share the results. So everybody should be able to see. And I'm gonna pass it on to Steph to read the results and tell us if we were right or not.
Hi there, I'm back. So thank you very much for being involved and for helping out with our questions and quiz. So number one, how big is your heart? Everyone got it right. 100% of people answered B, the fist. Number two, how many times does the average heart beat per minute? Again, a pretty strong majority got it right. The answer is 70 beats per minute on average. I just have to scroll down to the other responses. Number three, if a person doesn't exercise and is out of shape, would his or her heart beat faster or slower than 70 beats per minute? And once again, a pretty strong majority, 83% said faster, which is the correct answer. So the heart is a muscle. In fact, it's the most important muscle in our body. And if someone doesn't do regular exercise, such as brisk walking, the heart doesn't have the energy or to become as strong, and therefore has to work harder to pump blood through the body. So the heart having to work harder means that the heartbeat will be faster. So number four, as a person exercises and becomes more fit, does the heartbeat become faster or slower? And a strong majority, again, 75% said slower, which is correct. So for somebody who is inactive, once they begin to become active, such as, like I said, brisk walking or biking, the heart does become stronger and it can therefore pump more blood with each heartbeat. So athletes actually often have resting heartbeats that are quite low, such as in the 40s. And number 5, when does the heart rest? 67% said D, it never rests and it is always working. So 67 plus 8, 75% are actually wrong. Only 25% had the right response. So the only time that our heart rests is in between beats. It adds up to about 5 hours of resting time per day for the average person. And as we said, somebody who isn't active may have even less time for the heart to rest because their heart is having to beat faster, so there's not as many spaces between beats. So something that we'll talk quite a bit about, as you can imagine, will be aerobic exercise, which helps allow for more rest time between beats. So I'm hoping, there were some messages saying that the sound was breaking up really bad. I'm hoping that has become a little better. Does look like it has, that's good. So I'll move on to sort of get into some of the risk factors, as well as some of the things that we can do to help reduce our heart risk. So people with prediabetes or what's called metabolic syndrome are at a higher risk for developing heart disease. Some of the other risk factors are listed on page 97 of your handout. So you'll see it sort of broken down into 2 sections of risk factors, those that can't be changed or can't be controlled, and then those that can be changed. So risk factors that can't be changed include age, our gender, and our family history. And when they say gender, specifically males are at greater risk of heart disease. And when we look at risk factors that can be controlled, luckily you'll notice there's actually a lot more of them that we do have some control over. So the chart on page 97 shows things like high cholesterol, high blood pressure, diabetes status, overweight or obesity, physical inactivity, smoking, and poor diet. And all of these are risk factors that we do have some level of control over. And research actually suggests that about 70% of all heart disease could be prevented by addressing these personal risk factors. So on the end of page 97, you do have some space at this time that you could actually write down what your own risk factors may be and maybe which areas you'd like to try and work on, which we'll get into a little bit more later in the session as well. So page 98 of your handout shows what we call Life Simple 7, or 7 tips that help with preventing or managing heart disease. So I'll review some of these briefly and some of them in a little bit more detail, mainly related to the fact that some of them we've already sort of reviewed in quite a lot of detail in other classes. So number 1, get active. Recommendations from Heart and Stroke are to include 150 minutes of moderate to vigorous physical activity every day, or sorry, every week, 150 minutes every week, and 2 days of strength training activities or resistance training activities in a week. And research actually shows that a low fitness level can increase the risk of heart disease independent of body weight. So what we mean by that is whether a person is underweight, of average weight, or overweight, having a low fitness level still increases your risk for heart disease. Controlling cholesterol is number 2. So knowing the results of your own cholesterol tests can be quite effective and a really important conversation for you to have with your healthcare provider. Healthy cholesterol tends to keep, or healthy cholesterol levels keeps the arteries free of plaque, which can cause blood to be more difficult to pump through the artery walls. Number 3, eat better. So you'll notice that the healthy eating pattern recommended by Heart and Stroke Foundation of Canada, as well as by this program, are pretty much the same. So a pattern that includes a high amount of fruits and vegetables, whole grains, lean protein choices, and low-fat dairy. Number 4 is managing blood pressure. High blood pressure is also known as hypertension, which we'll talk about in a little more detail in a few minutes. Very few people actually know their most recent blood pressure. So every time somebody takes your blood pressure when you are in for a medical appointment, you should ask for it and actually write the results down. Again, it's sort of an important number to really keep track of, to know where you are in terms of the targets. Does anyone know what their target blood pressure might be? I'll get you to answer in the chat if you know the answer. So what would a target blood pressure be for most people? No. 120 over 80 or below. That's very close. So 120 over 80 is the general target range. For those living with diabetes, we like to see the number ideally below 130 over 90. And for anyone in the general population not living with diabetes or at high risk of heart disease, keeping it below 140 over 90 is target. But as Jenny mentioned, 120 over 80 or below is the best target range. Oh, okay. Yeah, Laura reminded everyone we have measured blood pressure at the beginning of the program, and it will be something that's measured again at the end. And hopefully that's a really good way for you to see some impact. So know your numbers for blood pressure. Number 5 is about maintaining a healthy body weight. So reaching and maintaining a weight loss goal can help to reduce the risk of heart disease and other health issues. And research actually demonstrates that as weight and physical activity improve, most of the risk factors for heart disease do so as well. The risk factor for heart diseases increase if there's a negative trend in weight and activity. So sort of the opposite. Number 6 is about reducing blood sugar or blood glucose levels. So the goal is to achieve and maintain blood sugar levels that are as close to normal as possible. Again, having a conversation with your healthcare provider about what risks you might have for diabetes, or if you're living with diabetes, knowing your A1C level and trying to keep that as closely as you can to target, working together with your healthcare providers. So I'll sort of review some of the main numbers that you might want to know for your own health. We tend to call the ABCs. So A is A1C, which is a 3-month blood sugar average. B is BP or blood pressure, and C is cholesterol. So those are numbers that most adults should be aware of their own levels as well as their own targets. And number 7 is about avoiding smoking and avoiding secondhand smoke. So as many of you are probably aware, smoking causes plaque to build up in the arteries more quickly. The really good news about this is the effect of quitting smoking can be seen within seconds of quitting. So the risks to our heart tend to start decreasing within seconds. And for anyone that needs information about it, I believe we've talked about it in the past, but there are a number of smoking cessation programs that can help people quit smoking or reduce the risk of their smoking or reduce the harm if they continue to smoke. So many local family health teams as well as the health unit have programs that can help people with this. So I'll move on a little more specifically to some information around cholesterol and blood pressure. as two of the most important concerns with regards to heart disease. So on page 100, you'll see it asks, which recommendations do you meet and which recommendations need your attention? So from the previous 7 recommendations, which ones do you feel that you're already close to meeting, and which ones might need some future attention? On page 101, I'll move on to cholesterol. So many people are actually surprised to find out that our body actually needs cholesterol. Cholesterol is one of the makers of things like hormones, as well as vitamin D and bile acid, which breaks down fat in our body. So cholesterol is actually quite an important thing. What we have to look at is trying to balance our good and our bad cholesterol levels. I'm assuming probably people have heard those terms before, so I'll get into what those mean. A good way to think about it is with the first letter of the name. So LDL is what we call our lousy or our bad cholesterol. And this is the level that, if elevated over a long period of time, tends to form plaque along the artery walls. So if we think about a typical artery looking something like this, if we have plaque along those walls, we tend to see a narrowing of the artery wall. I don't know if you can see that, I hope so. So when we see narrowing along those artery walls, it does make it more difficult for the heart to pump blood through our body, and it has to work that much harder. Our HDL cholesterol, or healthy cholesterol, on the other hand, we'll often term it like a vacuum. It actually tends to suck up some of the bad cholesterol before it has a chance to deposit and form plaques, and it brings some of that cholesterol back to the liver to be recycled and used in other ways. So boosting our healthy cholesterol can often be quite as just as important as lowering our bad cholesterol. Our triglyceride levels, they're a form of cholesterol that is the most common type of fat found in the body. So the triglycerides are often elevated in those who have high cholesterol, but also elevated in those who are living with diabetes. And the reason for that is because triglyceride levels are partially formed by sugar, and they're partially formed by fat. So triglycerides can be elevated as a result of sugar-sweetened beverage intake or alcohol intake as well. And a question popped up in our chat box. The bile that helps digest fat, is that part of the gallbladder's job? And yes, that's true. The bile is actually primarily produced by a duct near the gallbladder. So as I mentioned, in terms of cholesterol levels, you really want to know at the very least where your LDL levels and HDL levels are. And for many people, looking at triglyceride levels can also be quite an important marker. So again, an important thing to discuss with your physician. Facts about blood pressure. I'll move on to facts about blood pressure. So with regards to blood pressure, what is it? It's actually the force that's exerted against the artery walls as the blood flows through. So again, it's important to have blood pressure checked on a regular basis. And when blood pressure levels are high, it creates too much force against the artery walls. And this can cause damage to the arteries. Oh, I don't know if I would know how to. Okay, Laura's going to look into your question a little bit further, Monica, just so that we have make sure you have the right information. So again, when blood pressure, on the other hand, stays within healthy ranges, it actually reduces a lot of the strain that can be placed on your heart, on your arteries, and your kidneys, which of course would be important for health. The good news, once again, is lifestyle changes, whether it be physical activity, smoking, or a healthier diet, reducing smoking or having a healthier diet can help you to control cholesterol and blood pressure, which is what we'll move more into now. On page 102 and 103, there are some other information about areas that can help to impact both cholesterol and blood pressure. So one that is becoming more and more important and evident in research nowadays is sleep. And getting adequate sleep not only helps your heart, but can also have a positive impact on things like stress hormones, which impact diabetes. It has an impact on your immune system, your metabolism, as well as mental health or mental status. Another thing they talk about is if you use tobacco, quit or reduce. So again, smoking damages the entire circulatory system and does increase the risk of heart disease. Eating a healthy diet. So you'll notice following the recommendations of the dietary guidelines promoted in this program are the same dietary guidelines that are promoted by Heart and Stroke Canada. So one of those dietary guidelines is to eat less added sugar, which we'll get into in a little bit more detail towards the end of the class. And then eating a diet high in fiber also helps to reduce the risk of heart disease. So at this time, I'm going to move into another question, another polling question. So everyone keep their eyes peeled and I'll get Laura to post that. That's the question number one.
Okay.
Like saturated trans fat.
Okay, so which types of fats? Okay, so I'm gonna. Okay, so the poll is out and it says which types of fats are most important to monitor, limit, to reduce cholesterol levels. Is that the one? Yeah, okay, wonderful. So let me know if you can see it and start voting. Let us know which ones you think are important to monitor or limit. To reduce cholesterol. In Portuguese, people say castrol. It's a funny way to. So I see some people voting. Right? Take your time. So I'm just going to read the options for people on the phone line. So again, the question is which type of fats are most important to monitor / limit to reduce cholesterol levels? So the options are omega-3 and unsaturated fats, omega-3 and saturated fats and trans fats, and unsaturated and trans fats, right? So you have 10 people who voted already. I'm gonna wait a few more minutes, 11, there you go. And Monica, I do have the answer for your questions. So I'll just wait a little bit to let you know what you can do with our gallbladder. I personally had stones too, so I kind of sometimes wonder about that question as well. But apparently it's not a big issue. Yeah, I wasn't sure either, so I looked at it. All right, so I guess we're almost done. So I'm gonna end the poll and I'm gonna share the results now. So you should be able to see it, and I'm gonna pass on to Stephanie again to share the results and the correct answer.
So the results from our poll, so which types of fats are important to monitor or to limit to reduce cholesterol levels? 64% said saturated and trans fats, which was answer C, and 36% answered omega-3 and unsaturated fats. So the correct answer for was the one that the most people answered, which is saturated and trans fats. And there's actually a lot of research to show that replacing our unhealthy fats, which are saturated and trans fats, with healthy fats such as unsaturated fats and specifically omega-3 fats can help to reduce the incidence of heart disease. So if we look, I'm not sure which page it is in your handout. I believe maybe page 104 or so. You have some more information around the good and the bad fats. I read the question wrong. Somebody mentioned, and I sort of thought that might be the case. So the unsaturated and the omega-3 fats are actually healthy fats. So if you look at, again, I think it's page 104 of your handout, you'll see a little bit more information about the healthy and the unhealthy fats. I'll start with trans fats, which if we talk about fats as the good, the bad, and the ugly, we usually talk about trans fats as the ugly. The reason for that is they actually raise your bad cholesterol levels or your LDL cholesterol, and they lower your good cholesterol levels. So we'll often term it sort of like a double whammy or a double negative impact. So trans fats do increase the risk of heart disease and stroke, and they do increase the risk of type 2 diabetes as well. The good news about trans fats is as of the fall of 2018, Canada put a bill through that prevented or banned the use of trans fats in any products manufactured after that date. So after, I believe it was about September 2018. The bad news about this bill is that it did not result in foods that already had trans fats in them to be taken off of the market. So the assumption is that for a few years after 2018, so probably another year and a half or more, we do still have to look for trans fats on the label. Trans fats are required to be listed on every nutrition label in Canada and are ideal because of their negative impact is to keep the level at 0 grams, which I'll get into when we look at food labeling a little bit more in detail towards the end of the class. So our saturated fats, on the other hand, they're still quite important to limit, but not to the same extent as trans fats. So saturated fats can raise our bad cholesterol levels, but they're known to have either no impact or actually slightly raise our good cholesterol levels. So they're sort of the bad, they're not the ugly. And when we talk about saturated fats, we're primarily talking about animal fats. So any dairy and meat products do contain some level of saturated fats. The ones that we try and reduce tend to be those that are quite high in saturated fat. So cheeses, as an example, tend to be higher in saturated fat than milk or yogurt when we look at dairy products. Butter and tropical oils, such as coconut oil, palm oil, and palm kernel oil are quite high in saturated fats. And higher fat meats or higher fat cuts of meats, so certain beef products, certain pork products, skin on chicken, as an example, is higher in saturated fat than the actual meat. So choosing skinless poultry and choosing lean cuts of meats can help to lower your saturated fat content. So a question that I assume will come up, I'm actually sort of surprised it hasn't come up yet, is butter versus margarine. Every time you talk about fats, you're going to get that question. So when we look at cholesterol levels specifically, we know that saturated fats raise our bad cholesterol levels. So for anyone living with high cholesterol, we do encourage limiting butter consumption, as well as I mentioned, tropical oils, which are things like coconut and palm kernel oil. A non-hydrogenated margarine, which just means a margarine that does not have trans fats, are known to be safer for those living with high cholesterol. If we switch gears a little bit to the good fats, you'll remember I said replacing some of our unhealthy fats with healthy fats can be quite helpful. So one of the ways we could do this is instead of having toast with butter in the morning, we could have toast with peanut butter. So nuts and nut butters, such as peanut butter, are sources of unsaturated fats. I think you'll see yours broken down into what are called monounsaturated and polyunsaturated fats. All unsaturated fats are known to lower bad cholesterol levels, and they're known, again, to lower the risk of heart disease and stroke because of this. And certain ones can actually provide our body with essential fats that otherwise the body would not be able to produce. So I'll get into those in a little bit more detail. So our main sources of unsaturated fats tend to be plant-based oils, avocados, nuts and seeds, and nut butters, and fatty fish. So fatty fish are a source of a specific type of fat. I'll ask if anyone knows the answer. What type of fat do fatty fish provide? See if anyone has it. Oh. Omega. Yes, so Monica's right. Our omega-3 fats are provided primarily from fatty fish. Other sources include things like walnuts and ground flaxseed. The sources that we get in fatty fish, which are called APA and DHA, are essential fatty acids. So the body cannot produce those fats. We need to receive them from food sources. So having a healthy diet that includes good fats, limits saturated fats, and ideally eliminates or avoids trans fats, or keeping them as low as possible, has been shown to reduce the risk of heart disease significantly. I forget the exact stat. When the articles came out around banning trans fats within Canada, the stats were, I want to say, limiting, it was thousands and thousands, if not hundreds of thousands of deaths related to heart disease. So that one move of banning trans fats, they know will have quite a significant impact on the health of Canadians. And now I think is actually another good time for another polling question. So I'll hand it over to Laura to put up, well, I'll get Laura to post the question and I can read it out. I don't have it written on my. So our next question, what percentage of your total calories do you think should come from fat? And we'll wait a few minutes and give people a chance to answer. So the answers are 10 to 20%, 10 to 35%, 20 to 35%, or 45 to 65%.
All right, so we have 10 people answered so far. So wait a couple more seconds for the last ones to join. Tell us how much fat do we need, or how many calories should come from fat. All right. I guess we have 11, which is usually what we have so far. So what I'm going to do is I'm going to end the polling and share the results, and I'll pass it on to Steph again.
Okay, so again, what percentage of your total calories should come from fat? And this might actually be the first question that didn't have a majority voting one way. So 36% said 10 to 20%. 45% of people think that 10 to 35% is the correct answer. And 18% think that 20 to 35% is the correct answer, with no one responding 45 to 65%. So actually the lowest percentage of people got this answer right. So the correct answer is 20 to 35%. We'll often say, be careful not to get too much of a good thing. So even when we look at our healthy fats that we talked about, things like nuts and avocado and fatty fish, it's still important to try and get not too much of a good thing. So 20 to 35% of our total calories in our diet should come from fats. and ideally a higher proportion of those coming from our healthy fat sources. So I think people generally tend to seem to think that a lower percentage should come from fats. So that's definitely interesting to see. So it can be up to about a third of our total caloric intake in a day. If interested, you can, within your pages, there's more information on questions like this on Heart and Stroke website, as well as some other websites that are listed as well. So our next section is about reducing salt intake. And this might be an area that more people have probably heard about. Anyone diagnosed with high blood pressure has probably been told to try and reduce their salt intake. Higher salt intake primarily puts us at a higher risk for high blood pressure. The reason for that is because salt acts a lot like a sponge. So salt absorbs water or retains water within the system. And if our fluid volume is higher, so if our body is retaining more water, it means that our blood volume's higher, which means our heart has to work harder to pump that blood. So if we have fluid retention, which might be evident in things like swelling in the hands and feet, that can often be a sign of high blood pressure, and that means that your system's having to work a little bit harder to get that extra blood volume around. So one of the diets that are known to help reduce blood pressure levels specifically, and actually have been shown to reduce your risk of diabetes as well, is what's called the DASH diet. So that's called the dietary approaches to stop hypertension. So this diet lowered blood pressure as quickly as most medications. It's a diet that's quite high in, again, fruits and vegetables, whole grains, low-fat dairy, and low-fat meats, as well as higher in what's called meat alternatives or plant-based proteins. So things like beans, lentils, legumes, chickpeas are quite a high fiber source, so they're useful for the DASH diet, but they also replace saturated fats in the diet. So if we're eating vegetarian type meals, we're reducing the amount of cholesterol or saturated fat in the diet and replacing it with a healthier source of fiber for the diet. So you'll see a lot of information if you research DASH diet specifically. I'll highlight a few of the key recommendations. Tend to be getting 8 to 10 servings of fruits and vegetables in a day. So it's actually higher than Canada's Food Guide recommendations. And 3 servings of low-fat dairy in a day for adults as well. And that helps to promote adequate calcium and magnesium, which have been shown to be quite important minerals when we look at blood pressure control. Mainly what we get from our high amount of fruits and vegetables is a higher potassium intake, which again tends to help promote healthier blood pressure. So when people are diagnosed with either high cholesterol levels or high blood pressure, you'll likely hear the term risk or risk score. So your healthcare provider actually assesses risk based on a number of factors and hopefully will give you some indications on the best way to manage it. Depending on where the risk level are, prescription medications may be required for a lot of people to lower their cholesterol and to lower their blood pressure levels. That does not take place of a healthy diet. So anyone who takes what's called a statin medication, which is to lower cholesterol, or anyone who takes a number of medications to control blood pressure, the impact of a healthy diet is not negated by the fact that you're on medication and can actually make the medication work that much better to reduce your heart risk. And there's actually a lot of research showing particularly when we look at statin medications, which are the most effective medications for lowering cholesterol levels. Replacing saturated and trans fats with unsaturated fats in the diet can reduce cholesterol levels as much as statin medications can, which is about a 30% reduction. So we can see a very significant impact by consuming healthier fats and by following specific meal plans or diets, such as the DASH diet, or Mediterranean diet would be another one that you'll often hear about. And Cheryl posted, they also have a lot of side effects. So there are many people, I'm not sure of the percentage, unfortunately, but there are a significant portion of people who do not tolerate statin medications very well. And for those people, again, the importance of a healthy diet will be even that much more important. They are quite an effective medication, but unfortunately for a certain percentage of people, they do have a lot of side effects, primarily in terms of pain to the legs is what you'll most often hear, or muscle cramping. So I'll post our last, or I'll have Laura post our last polling question, which is about how much salt or what percentage of salt we get from processed and packaged foods. So the question reads, what percentage of salt in the average North American diet tends to come from processed, packaged, and restaurant foods? So A is 20%, B is 40%, C is 75%, and D is 90%. So we'll give you guys a few moments to answer that.
I think right now, because everybody's at home, is less than usual. But if we think in a normal time, yeah, we'll let you guys decide for sure. Yeah, I don't know if you ever experienced. Sometimes I go to a restaurant, and it's just the amount of salt doesn't even let you enjoy the rest of the food, right? So it's yeah, it's a bit concerning. Right, so we have 11 people who participated, so I think that's usually all the people who participate. So I'm gonna end the polling, share the results, and pass on to Steph to talk a little bit more about the current answer.
So 82% had the correct answer. So 75% of all the typical salt in an average North American diet tends to come from processed and restaurant foods. So that means only 25% of the typical amount of salt that we would eat tends to come from what we add at the table, or from the amount that's naturally found in foods, or what we add while cooking. So the amount added while cooking, added at the table, and naturally found in foods only gives us about 25% of the typical amount. As Laura mentioned, everyone's blood pressure might be a little bit lower right now, because a lot of us are likely eating less restaurant foods, less takeout foods, and hopefully having a little bit more time at home to experiment with some recipes and with some cooking at home, which will help to lower the amount of sodium in the diet, or the amount of salt. So we'll move into a little bit in terms of sample labeling and what we might look for when we're looking at lowering our risk of heart disease. So if we look on a typical label, nutrition label or nutrition facts table in Canada, what information might be useful to us, and what types of things might we want to try and lower on those nutrition facts labels. So there tends to be 4 main things that we look at when we're talking about heart disease specifically, or heart health risk: grams of saturated and grams of trans fats, the milligrams of sodium, the grams of dietary fiber, and the grams of sugar. Unfortunately, added sugar is not yet found on nutrition labels within Canada. There is a big push from dietitians and others to try and include that so that people can differentiate the amount of sugar that's found naturally versus the amount that's added. A good example of this would be yogurt. Depending on the type of yogurt we choose, we can get quite a bit of added sugar as opposed to the small amount that's actually naturally found in most yogurts. So again, if we're looking for heart healthier choices, when we look at a nutrition facts label, the first one near the top that we tend to see will be total fat. And then underneath that, you'll see, so you'll see total fat bolded. And then underneath that, not bolded, you'll see saturated and then trans fats. So as I mentioned, ideally we want to keep trans fats to 0 grams as much as possible. The areas that we might still see trans fats in the diet are packaged products that have a really long shelf life. So things that have been on the shelf since prior to September 2018 still have the potential to have trans fats. Some of these things include things like cookies and crackers. Certain snack foods like pretzels may potentially have trans fats. So we still want to look at all our packaged products and try and get 0 grams trans fat. Above that, as I mentioned, you have saturated fat. And if you look at what's called percentage daily value, which is on the right side of the nutrition facts tables, our percent daily value for saturated fat and trans fats is actually combined. So does anyone have an idea of what amount we might want to limit that to for the percent daily value? So percent daily value for saturated fat and trans fats. We can put it in the chat box after for anyone that wants to write it down. No answers yet. So for percent daily value, I am not allowed to answer. Dr. Corneal's not allowed to answer. So for percent daily value of what's called saturated and trans fats, which as I mentioned is a combined value, we like to encourage people to look for less than 10%. So less than 5% of any of the daily values is considered to be just a little bit of that nutrient. Unfortunately, it's going to be really difficult to find foods that are less than 5% for saturated fat and trans fat. So less than 10% is sort of a happy medium, if you want to call it that. So we look for less than 10% for saturated and trans fats. We can actually use that same number to look for a lower amount of sodium on products. So less than 10% for sodium as well can be a lower sodium option. And then, as I mentioned, the last area we might want to look for on nutrition facts tables for heart health is fiber. And as you can imagine, when we're talking about lowering risk of heart health, we actually want to add fiber to our diet or try and get more fiber in the diet. So we can use that same 10%, but we want to look for greater than 10% for fiber. So as a bit of a quick recap, if we're looking to lower our heart risk, when we look at nutrition facts tables, we like to look for 0 grams of trans fats, less than 10% for the daily value of saturated and trans fats, less than 10% for the daily value of sodium, and greater or more than 10% for the daily value of fiber. Now, it's important to note for fiber specifically, there's only certain products that we might look at finding that in. So meat products and dairy products do not provide a source of fiber typically. So mainly it's only your fruits and vegetables and your grain products would be the big one where you're going to look for higher amounts of fiber. So when we look at breads, pastas, rices, cereals, looking for a higher amount of fiber can be quite useful to lowering your risk of heart disease. So, and on this section or below this in your, again, I'm not sure, I think it's about page 105, 106. Below the nutrition facts table, you do have an area where you can jot down a few specific changes that you think you might be able to make heart healthier choices. Another way that we can use the percent daily value that's quite useful is actually as a comparison tool. So even if you can't find products, say you're looking for breaded chicken and you can't find a product that has less than 10% for the daily value of saturated fat, you can use the percent daily value to compare different products and try and choose the one with the lowest amount of saturated fat. So that's sort of a brief overview of what we can do to help lower our heart disease risk and to try and keep our heart healthy as we get older. Are there any questions that come up? I know we're sort of close to the end. Well, we're at the end of time, but if there's any questions, we're more than happy to answer.
And I'm gonna now allow everyone to talk, so bear with me and while I go through all of you. And I still have to answer, one second, I still have to answer Monica's question. Yeah, I'll just, again, just give me 1 second here. I am allowing everyone to talk. You just have to check if you're muted. If you're muted, you can unmute yourself and then you should be able to talk. And I'm gonna ask if you want to talk and ask questions, just let us know your name, just in case we're not able to see it. But I think we're done. Oh, no, there you go. Okay, so yeah, you guys can unmute yourselves if you want, or let me just see if I can do that here. All right. Okay, so everyone should be able to talk. If not, just let me know and I'll try to figure out what's going on. This is a trial. Yeah, I think I can see some people here that are not muted. There you go, everybody. Oh. Okay, so, all right. So I'm gonna go first through, let me just change my view in here. All right, so I'm gonna go first just to Monica's question about the gallbladder, and I'm gonna read it because I think it's better than me just trying to say it by my own words. All right, so what it says here is, your liver continues to make bile after your gallbladder is removed, but the bile flows more directly into the intestine instead of collecting in the gallbladder. So without a gallbladder, which gives bile a chance to pool and stones a place to form, you still have enough bile to aid your digestion. So there's little reason for you or others who have had their gallbladders removed to take bile salts. So basically you still have what you need, it's just not being stored, it's going directly to where it's needed. And that also means that there's no chance to get stones, which I guess it's a good thing. Monica, let me know if that answered your question. So we're gonna go up here, see what we have. All right. So Jenny said, right now I find it hard to take time to read labels like you usually do because I don't want to hold people up. Yeah, they aren't supposed to pass in the aisle. That's a good observation. I think my suggestion in this case is maybe take a mental note or write it down on paper or on your phone of what it is that you're looking for, and then go home and try find it online, because you pretty much can find everything online these days, like, you know, any brand, any flavor of whatever product it is. Because you're right, it's kind of, you know, you don't want to be in the middle of the aisle like, oh, I'm just gonna take a look at all these all this stuff. Stephanie, is there anything else that you can think of that can help with that?
Yeah, I would just agree with Laura. Most manufacturers do have their nutrition facts tables now available online. So if you know you're usually looking for a specific brand or a specific type of food, you could try and do a little bit of research ahead of time online to know which product might be best or which brand might be best. The one thing I'll sort of caution people against is sometimes when you research, as an example, if you researched fat content in sweet and salty granola bars, you might get what's called like what people have posted as the nutrition facts tables. And I would prefer to see people go through the manufacturers and make sure you're on Canadian websites, because a lot of times you might see what Americans have posted.
Yep, that's definitely good advice. Right, so then another one, well, Sue says she doesn't have a microphone. That's copy that, Sue. And some others might not have it either. So you always welcome to write on the chat box. Then Janice asks, how does drinking a lot of water affect your sodium levels? Stephanie, would you like to take this one, or?
Yeah.
Yep.
So drinking a lot of sodium, drinking a lot of sodium, drinking a lot of water can affect what's called your blood sodium levels, because it affects your hydration status, but it doesn't have any impact on your sodium intake, if that makes sense. So what I mean by that is drinking a lot of water does not necessarily flush your system or get rid of excess sodium that you intake, because your kidneys are responsible for trying to get rid of that excess sodium. So the amount of water we drink more so impacts our hydration status rather than directly impacting sodium levels.
Right. And then Jenny, and maybe we lost Jenny, but she said she was able to catch the answers. That was good. And then there's Sam here saying that if you have the PC Express app, which I think, oh, there's an echo. I think, did you mute yourself, Stephanie? Yeah, there you go. I think it's, yeah. It's just we and Stephanie are actually in the same room, but if we don't mute ourselves when each other is talking, get some echo. So I was reading that Sam suggested that if you have the PC Express app, which I'm assuming is for the President Choice, so the independent store. So if you're making an order, you can check all the products in the store, in the search bar, and see the nutrition labels in there. So that's a good one too, because that's more of a reliable source as well. And I think actually too, I think it's the independent and Loblaws and all that chain that has the, I can't remember what is it called now, it's something star, that sort of rates the foods in terms of the nutrition quality. So not all of them will be rated and all that, but if you go to the store and you look at the price labels, you will see some have 2 stars, some have 3 stars. And so that sort of helps guide what could be a good option or not. So again, it's just a tip to know more. All right. So, right. It helps social distance, of course. Yes. And get your orders in early. I'm assuming it's a bit backlogged, eh? Yeah. All right. So I'm just going to give you the chance to ask any last questions or make any comments. Again, feel free to talk as well. Just 1 second. So I'm just going to wait a couple more minutes. Oh, is there someone else? I thought I heard something. Yeah. All right. Okay, so seeing nothing else in the chat box or anyone talking as well. So I guess that's it for today. If you have any questions after this, you can email Sue or myself, and then we'll get back to you and connect with Steph and then get back to you. And Other than that, like I said, just a reminder that our next session is May the 5th, and that will be Courtney. Courtney is coming from CMHA, and we're going to talk about stress management, if I'm not mistaken, but I can't remember very well. But anyway, so we'll be talking about that, and that will be our second last session. And again, like I said earlier in this session, we'll be talking to you next time about where our plans are for, you know, for the last session, what we're going to do depending on how things change from now to the next 2 weeks in terms of the situation. And as I look outside, it's still snowing, so I guess Christmas is officially here. So that's it for today. Stay safe, take care of yourself, take care of your loved ones, and again, if you have any questions, any comments, anything that you need, just email us, and then we'll keep connected. And I'll see you in 2 weeks. All right. So have a great day, evening, I guess.
Bye.
Goodbye.
Can I put it on the TV?